Welcome to the Community Health Heroes Show, where we spotlight local organizations that provide much-needed health and wellness resources and information so that everyone in our community can strive to live healthier, happier, and longer lives. I'm Dr. Penny Walker, Senior Medical Director for United Healthcare, Southeast Region. Today on Community Health Heroes, we'll be speaking with Mike Rogers, CEO of Smoking Cessation Trust, who will talk about the upcoming Great American Smokeout on November 19th. Dr. Harold Miller, board-certified endocrinologist and member of the Louisiana State Medical Society, who will discuss the prevalence of diabetes in Louisiana and what we can do to prevent and treat it. And Carlos Streber and Chef Miguel Chavez of Superior Grill, who will prepare pan-seared salmon salad and ceviche in today's Eat Fit Vanilla cooking segment. So don't go away, we'll be right back with more Community Health Heroes.
Getting closer to nature can get you closer to your family. Go to discovertheforest.org.
You and your team are a machine. But what happens when your team loses their coach? Your game falls apart. 1 in 5 African American men will be diagnosed with prostate cancer. Facing cancer alone is like a game without a coach. That's why coaches from over 30 collegiate conferences want you to have a plan. OnTheLine.com. Find the prostate cancer information that lets you stay in the game. OnTheLine.com, because your health is on the line.
Thursday, November 19th is the Great American Smokeout, a day created in 1977 by the American Cancer Society to encourage smokers to quit and donate the money they would have spent on cigarettes to a charity. Here today to talk about how you can use the Great American Smokeout as your target date to kick your habit and the free smoking cessation products and services available through Smoking Cessation Trust to help you do it is Mike Rogers, CEO of the Smoking Cessation Trust Management Services. Welcome back to the show, Mike.
Thanks for having me again. It's good to be here.
So can you tell me about the progress you've made since the last time you were here?
Yeah, we've made pretty good progress on adding new members to the health. I call it a health plan. It's not really. It's a little piece, but we're now just over 42,000 applicants processed. That gives us about 40,000, just over 40,386, I think, as of this morning, to be relatively exact, that were approved. So we're running still right at 90% of all applicants get approved by the judge.
And so what kind of programs and services do you offer to the public?
Well, the court ordered specific services. There's 4 things. Well, I say 4 things. I say 4 because that's what the court says, but when you talk to real people, it comes out a little different. Quitline services, which is telephonic help and coaching, medicines, and even over-counter medicines that are recommended to treat tobacco addiction. We have a certain number of physician visits that you can do, individual counseling visits, and then group counseling. We try to get everybody to do a combination of some kind of medication to help them get rid of the urges and stuff, and then we also try to get them involved with the clinical side of the house. So we really want you to go see your doctor. We want them involved. We really want to see you get into group counseling, though we don't push you to do that, but we really want you to do that. Because all the evidence says you're going to have an easier time quitting. It's going to stick potentially better if you do multiple of those treatment modalities.
And how long is the program?
Well, the program itself is 10 years, but every member, once they become an approved member by the judge, is a member for that whole 10 years or whatever segment of that 10 years is left. The importance of that is statistics say, it's going to take the average smoker 7 to 11 times attempts to quit for good. Our program, you're in for every year you get 2 120-day benefit periods. So basically you have 2/3 of every year that you can be in treatment and we're paying for it.
That's awesome. So how is this linked to the Great American Smokeout?
Well, we're not really linked. What we do is we try to take advantage of the sort of mainstream events that are out there in public land, if you will, that are related to smoking cessation. The Great American Smokeout's one of the biggest ones. When we try to get people to quit, we want to go big, Well, Smokeouts takes the other sort of angle and says, smoking's hard, really hard. So let's not say put them down forever. That's what we want you to do.
Right.
But let's say, can you quit for one day?
Right.
And just take that money in order to give you an idea of how much money you're spending, wasting, burning, blowing up in smoke on cigarettes, is take that little bit of money for that one day and give it to charity. So I think it's masterful on their part to have come up with a let's try little. Okay, just quit for today. Don't quit for forever. Don't tell your mind you got to put it down and never pick it up again. That's a barrier, right? But quit for today. And so you understand how much you're spending. Give that money for that one day to a charity of your choice. It's a great idea.
It's an awesome idea. What can our audience do if they want to get their friends or family, their neighbor to quit smoking?
Well, if they began smoking prior to September 1, 1988, it's the best thing they could do is join the trust, because everything they get that's approved for treating tobacco is covered by us. So you don't pay anything to be in it. You can do that through our website, www.smokefreela.org.
Okay.
You can call a telephone number locally of 504-529-5665. If I give you the toll-free number, I'll mess it up, so I just won't even try.
So it's a local company, it's a local
It is.
organization.
We're based in the New Orleans area. We are statewide. We have members in every parish in the state. We have provider organizations, I wouldn't say widely participating across the state, though we do have providers in every location. But we have really, really good provider partners in the toe of the boot and up to Baton Rouge. We're getting ready to sign a deal in Lafayette that will make us much better in Lafayette. And so we're working in the outlying areas. We did everything by population, so we looked at the toe and we're going outward toward the rest of the population. So but it takes us a little more time to get the north fully functioning the way, so it's convenient for people to get the care. Right now, you can get the medications, you can get the phone stuff, you can find a local doctor to help you, but it's maybe a little hard in places like Shreveport and some of the rural areas. But most of the rest of the cities, we have pretty good participation.
Is there anything else you'd like to share with us today?
Well, quit smoking.
Well, thank you so much for being on the show and providing us with very important information.
That's a pleasure. Thank you.
When we return, we'll be speaking with Dr. Harold Miller, who will tell us about diabetes prevention and treatment. So don't go away. We'll be right back with more Community Health Heroes.
Here we go. We're gonna make some juice.
It's gonna be good.
She's excited. A little bit of kale.
Please don't put this online.
I'm putting it all over the line.
It's wet. It needs something. No, it'll go.
Don't break my juicer. Looks good.
You ready to try it?
Come on, baby.
Challenge your kids to be active and eat healthy.
It's okay.
Okay, all right.
They might surprise you.
Hey, she took another sip. You saw it?
Search We Can for more ideas on how you and your kids can get healthy together.
2 outs with a runner on first base. Now the big guy comes off the bat, hitting .342 with 92 RBIs and 36 home runs. First pitch is fouled to the back.
Chill raw and prepared foods promptly. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Did you know that 1 out of every 3 children born after 2000 in the United States will be directly affected by diabetes? Joining us today to talk about diabetes prevention and treatment is Dr. Harold Miller, board-certified endocrinologist and member of the Louisiana State Medical Society. So welcome to the show, Dr. Miller.
Thank you very much. I'm honored to be here. I'm speaking on behalf of the Louisiana State Medical Society, and look forward to the questions.
Great. So you're an endocrinologist, and that's a person who specializes in diabetes and endocrine disorders. Can you tell me what the signs and symptoms of diabetes are?
Well, when you're in med school, on board exam questions, polyuria, polydipsia, and polyphagia. Those are the medical terms, but typically it means you pee a lot, eat a lot, and are very thirsty. So, those aspects of diabetes are very subtle because we live in the South. It's very hot. And many times I'll get people who work outdoors, they do hard working jobs in construction, and they're used to being thirsty. And unfortunately, these symptoms are very subtle and very hidden because they think that, hey, I'm just thirsty. Many times as a clinician with several thousand patients on my panel, I will get the wife bringing the husband, and they just happen to have a great uncle who has a glucometer, and Bobby, who works in construction, is checked with the uncle's meter, and the glucose is 400.
Oh, wow. So, Dr. Miller, can you tell me about what people can do to help prevent diabetes from even occurring?
Well, a famous statesman once said, an ounce of prevention is a pound of cure. And when I'm in the office talking to patients, the thing I bring up about this term pre-diabetes, if you can educate many times family members, you look at family history is number one. If you know that you have an uncle or a father or a mother or an aunt that has had diabetes, if you look at, we call pattern recognition, which is often a lost gift in medicine, the art of medicine, being able to look at the waist size of the patient, and if the man is greater than 40 inches, if the woman is greater than 38 inches, all the 36 inches, these are all terms relative to the BMI, body mass index. If you look at family history of heart disease, family history of diabetes, all these things stem or portend towards the risk of becoming a diabetic. So prevention means identifying your own risk factors individually. When you look at prevention, the comment I bring up, if one can lose about 10% of body weight, or some books will say 7%, you reduce your risk of diabetes by 50%.
Right, that's right.
That's a very strong statistic. It's in layman's terms, you can't get any more concrete than that.
Right.
If you have a 220-pound man in your office, if he loses 22 pounds, you reduce your risk of diabetes by 50%. What I tell patients is that the importance of reducing the risk of diabetes in your own individual life is that by the time one sees Dr. Miller, and there are some statistics out there that there are about 30% of the 25, there are 25 million diabetics in this country today.
That's crazy.
But in the statistics of reducing your risk of diabetes, when you look at the person that's a pre-diabetic, they claim that there can be as many as a third of the population today are pre-diabetics.
Oh my
They're
gosh.
walking around, they may not even know they have diabetes. So prevention involves studying your family history. Number one, going to your primary care provider, whether it's a nurse practitioner, the American Diabetes Association has programs. Many times there are screenings at malls. The so-called hemoglobin A1C is a very powerful tool. Many times it's a finger stick, and it gives a number. And typically, you want that number to be less than 5.7%. The diabetic, by definition, is greater than 6.5%. It's a one number, takes about seconds to do, maybe about 20, 30 seconds on a finger stick, even at a shopping center. So I encourage people to take advantage of free screenings. The American Diabetes Association has all sorts of avenues towards prevention. Exercise, just getting in the habit. You know, I work a lot of hours, and I've learned in my own life to learn to incorporate exercise in my week. The old expression is, if it was easy, everyone would do it. Well, unfortunately, exercise is not easy for those of us that are not athletes. So that's when I emphasize that term of, if you reduce your weight by 10%, you reduce your risk by 50%. Try to have about 30 minutes of exercise, aerobic exercise, 5 days a week. I was reading an article, how do you determine when you're exercising properly? Well, the old rule of thumb is if you can't sing while you're exercising, that's good aerobic activity.
And I understand you have a really exciting event coming up soon.
Well, it's sponsored by the American Diabetes Association. So, as I said, I'm a busy clinician, but anything that I can do actually to prevent diabetics or people from becoming diabetes or helping to spread the word. On November 14th, the ADA has a walk at Audubon Park, and I provided the details to the people here so they can post it.
Okay.
And I think that would be very valuable. There are other organizations like the YMCA, other local avenues. Of course, there's the ADA as well that one can contact.
And if we want to find more information about preventing diabetes or learning more about diabetes, where could we go to get that information?
Well, we have a very active American Diabetes Association locally. The phone number is 504-342-2283.
Okay.
If my prompting tells me that, I believe there's a 1-800 number that you can also contact. And also the website is very good. I don't have a lot of spare time, but I think if you challenge people, just look ada.org. There are tons of information, free information, that lay people can go out there and get some general information to basically prevent this epidemic from spreading.
Well, thank you so much for providing all this information for our viewing audience and for being on the show today.
Well, it's my pleasure, and again, on behalf of Louisiana State Medical Society, we care, and I'm honored to have this time to spend with you.
Thank you. Coming up next, we'll be in the kitchen with Carlos Streber and Chef Miguel Chavez of Superior Grill when they join us for our Eat Fit NOLA cooking segment. So don't go away. We'll be right back with more Community Health Heroes.
I'm Molly Kimball, registered dietitian with Oxnard's Elmwood Fitness Center. We've collaborated with more than 60 local restaurants to create Eat Fit NOLA, a partnership that highlights the better-for-you items right there on a restaurant's menu, making it effortless for you to dine at your favorite New Orleans restaurant without ditching your otherwise healthy diet. Every month, the Community Health Heroes Show will shine a spotlight on one of our city's incredible chefs who will show you how you can make healthier choices when dining at theirs or any of our city's great restaurants. So don't go away. Community Health Heroes will be right back.
Hi, I'm Kathy Ireland. I enjoy great careers in fashion, design, and business. The most important responsibilities to me are being a wife and mother to my family. We all need to be here for our families, so please let's do our best to stay healthy. And at my age, that means getting screened for colon cancer. Colon cancer claims the lives of 50,000 men and women each year, but it doesn't have to. Colon cancer can often be prevented or caught early through screening. If you are 50 or over, or have a family history of colon cancer, please talk with your doctor about getting screened. It could save your life. I got screened. Did you? For more information, please visit screenforcoloncancer.org. Thank you.
Welcome back. Joining us for today's Eat Fit NOLA cooking segment is Carlos Streber and Chef Miguel Chavez of Superior Grill. Thanks so much for joining us today. And what are we going to be making?
Today we're going to be making a fresh salmon salad with arugula, mango salsa, Bermuda onions, and a slice of tomato with a vinaigrette of lemon, Tabasco, agave nectar, vinegar sauce.
It looks absolutely wonderful. So go ahead and start preparing our wonderful dish here. And looks.
So what I did was actually coated the salmon with the agave nectar, then mix it with the spices, no sugar, no salt added, and add some cilantro to give color. Then I'm gonna saute it to make sure it's golden brown. So in between, that is getting ready. I'm gonna be doing the vinaigrette.
You're gonna make a vinaigrette?
Yes, vinaigrette dressing.
So this is first orange.
His own homemade recipe.
Fresh squeezed orange juice, yummy.
Fresh orange juice. A little bit of Tabasco sauce.
A little bit of Tabasco, and there's no sugar in that, and no salt, I understand.
A little bit of, I will add a little bit of agave nectar.
Okay.
Just to give flavor on it.
So how did you modify some of your recipes so that they were Eat Fit NOLA healthy?
A lot of the recipes we modify by using organic peanut butters, using lye agave nectar, stevia as a sauce, extra virgin olive oil. So pretty much cutting all the fat and all the GMOs of the food.
Okay, awesome.
So then I will add a little bit of olive oil.
That's very simple, and you got a little bit of sweetness from the orange juice.
The orange juice and the agave nectar in there.
Yeah.
And I understand you used to use more of the boils too, and that had a lot of salt in it.
Yes, so now we actually shifted to the boils from using stuff as bay leaf. There is another spice that we use a lot, and is hoja santa. It's very popular in Mexican cuisine. We're using the peel of the shrimps to get the flavor on it.
Oh, okay.
And we're using actually a lot of the product from Chef Paul, which is no salt, no
Yeah, I didn't know that didn't
sugar
have salt
added.
in it. That's awesome.
But actually has the whole flavor on it. So that's what I do. So vinaigrette is ready. So I have the mango salsa already done, and I can toss it. So right here is fresh mangoes.
So this is how you made your salsa.
The Bermuda onions, a little bit of jalapeno chopped, red pepper, and cilantro.
It's very colorful too. Most people think healthy food is boring, but this is very colorful.
Lemon juice. Just a touch of salt and pepper.
A little pinch.
Just give it a little bit of flavor on it. So we mix it together.
And then about how many items on the menu are Eat Fit NOLA healthy now?
As of right now, we have about 10 to 12 items on the menu.
That's a lot of items.
They go from fajitas to steaks.
Oh, wow.
Ceviche. We also have a shrimp cocktail. And then we also have a zucchini tuna salad and a tuna steak with grilled vegetables.
Oh, yummy. And where are y'all located that we can try all the Eat Fit NOLA?
Absolutely, we're at 3636 St. Charles Avenue, right in between Louisiana and McLean.
Great area.
Very, very good area. It's good. You know, we're on St. Charles streetcar line, and we have a lot of tourists that come in to visit us as well.
We have our arugula in the salad, toasted with the vinegar.
And the Eat Fit NOLA recipes or menu items, they have a little symbol by them?
Yes, once our menus are ready to roll, we'll have those the Ochsner logo right next to those items. And then if they have any questions, they're more than welcome to ask the server for more details on those items.
Awesome.
So we're almost getting done.
Flip it over a little bit.
So we get nice color on it.
Beautiful.
And then I'm gonna garnish this with a little Bermuda onion.
At the Mexican restaurant, we have a lot of cheese and rice and beans. So we've been able to substitute all of those items with steamed vegetables, sauteed
wow.
spinach, and zucchini. So if anyone wants to, substitute any of those items, we're more than happy to do those as well.
That's great. I mean, it's 12 different menu items that are all healthy now.
So now the salmon is pretty much ready.
And it smells so delicious.
It's delicious.
And then with the mango salsa, we actually just throw this out.
Wow, that is just beautiful.
It is yummy, that's for sure.
You get nice color on it, and it'll have all your components in there.
So this is our pan-seared salmon salad.
Awesome. Now, did you have another item you were going to show us?
We do.
That is beautiful.
We do have the ceviche.
Oh, wow.
That needs to cook overnight. It's actually fresh local fish with fresh local shrimps, toasted with garlic, oregano, lemon juice, olive oil, salt and pepper. And actually, instead of the potato chips, we're using carrots and celery sticks.
Oh, wow.
So we do have, for those that don't need healthy fish food, we do have the sirloin with fresh grilled vegetables.
And that's on the Eat Fit NOLA menu too?
Yes,
Oh my
it
gosh.
is. 8-ounce sirloin
Oh, that's
with
beautiful.
steamed vegetables. And they all come with a house salad.
Actually, our vinaigrette is made with stevia, organic peanut butter, and extra virgin olive oil.
And now what is this? So that's
That's
your
the
house
side
salad?
salad.
Oh my gosh. So you get all that.
Yes, you have different options. Yes, all of our entrees, you have an option of the vegetables, and they all come with a house salad.
That's a
with
lot
the
of
Eat Fit
food.
NOLA vinaigrette dressing. So
Awesome.
come on down and enjoy our dishes.
Well, thank you both for being on the show. I mean, these are absolutely delicious looking and smelling choices on our Eat Fit NOLA menu.
And then we'll have the menu online as soon as we have those ready. And then they can go on eatfitnola.com, and if they have any questions, give us a call.
Awesome. Thank you both so much for joining us on the show today and preparing these delicious Eat Fit NOLA menu items.
Thank you so much.
Thank you for having us.
And we'll be right back with more Community Health Heroes.
Clean kitchen surfaces, utensils, and hands with soapy water. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Body language can tell you all sorts of things. Like someone is having a stroke. Know the sudden signs. Learn fast. Face drooping, arm weakness, speech difficulty. Time to call 911 and get them to a hospital immediately. Learn the body language and spot a stroke fast.
Thank you so much for joining us. If you would like to suggest a health topic, send us information on your health organization's events, or recommend your favorite Eat Fit NOLA restaurant, please visit our Facebook page or email us at communityhealthheroes@gmail.com or visit our website at www.communityhealthheroes.org. You can also find our show on YouTube. We hope that the information we provide today will help you and your family live healthier and happier lives. I'm Dr. Penny Walker. Join us next time for Community Health Heroes.